Welcome, judges. We are part of Inside Team. Myself, Ravindra, and Ruben. We have named this project as CAP Insights, our clinicians' digital partner. So we are problem solving for two people. One is physicians and patients. By physicians, we are basically reducing the administrative burden of the need for documentation effort that is required as part of the digitalization of the patient records. So we are cutting down on that, as well as suggesting medication and test procedures based on the diagnostic conversations that have been having between patient and doctor, as well as conversion of medical records to other vernacular languages as defined by the doctor. Uh, Aiding patients by ordering or suggesting the medication or tests or procedures, as well as suggesting specialists for second opinion. So all telemedicine players as well as hospitals and clinicians, everybody needs to be compliant with maintaining the patient's record in the future. So obviously they are our target customers, as well as benefits wise. Um, since we are capturing this information firsthand, as the doctor says or writes, so it's as quality wise, this is the best data, as well as we are reducing the administrative burden. That's an additional benefit, as well as we are also capturing the effectiveness of the medications that are being prescribed by the doctor to the patients. We are in turn we are helping pharmaceutical players in bettering their medicines. Why do you care about solving this problem? We want to reduce the administrative workload of the medical professionals to enable digitalization of the patient records. Also suggest any relevant and cost efficient medication based on the effectiveness of the tech drugs in the local context, like the gender, age, or the criticality with which the patient is. Based on all those stuff, probably we will suggest some drugs, as well as we have an implementation expertise, and our team has worked on diagnostic and EMR solutions to UK and US markets, so they are pretty much comfortable with the process and procedures that go along with the healthcare industry. So, and we want to make it a better, easier for India in adopting the healthcare at a more affordable cost. So we are either using voice to text conversion or a digital plan, both mechanisms, so that we capture the conversations between the patient and doctor, or we capture the written information that is being used via digital pen, and then automatically converting it as an electronic record. And doctor can review that and approve now the content once they are comfortable with after editing, if there is any required. Also, we have some standardized templates for diagnostic reports and prescription formats. So based on the specific type of condition that the patient has come with, we may auto suggest some of the reports, so the doctor needs to just fill in the blanks and finish the reports. So that's as easy as I've said. As well as we are partnering with the pharmaceutical industries to get the information related to the effectiveness of the prescribed medication in the local context, as I mentioned earlier. So this would benefit the pharmaceutical players as a huge benefit. Also, we are offering it as a service, so it can be availed by any telemedicine providers, hospitals, or clinicians at an affordable cost. How does it relate to PHR? Um, we are in essence trying to automate the patient health record. So capturing the first-hand information of what doctor says, so that the quality of the information is maintained. Also, since we are providing templatized reports, so that would be insurance friendly, and it would be able to for them to easily claim, for the claim process. As I said earlier, our customers are telemedicine players, hospitals, and clinicians. target the telemedicine to be our reference customer. So we want to have one beta customer who would be confident of our system, and he will be a reference customer going forward. And once we have got the gain the confidence of the reference customer, probably we'll showcase on the his strengths and his growth plans, and probably even demo to clinicians, hospitals, as well as government bodies, to promote our product. So, as I mentioned earlier, we are since it is a voice to text based, and as well as vernacular services is being provided, we would utilize the healthcare specific cloud service providers initially, like AWS and Micro Azure. To offer this, we will incorporate them and bundle it with our services, and also we are yet to finalize on the digital pen and board features that we need to provide with. Also, as mentioned, we are partnering with small telecom consultation providers as early adopters or reference customers, and from there we want to get around. Cost wise, it is around 10K to 15K to build a working increment in 3 to 5 months cycle. That's what we are aiming for. And revenue, we are planning for a subscription based model with as low as 20 cents per consultation. It's a transaction based model. And also we aim to monetize it, by providing pharmaceutical players with drug effectiveness data, so they would be interested in it. Our competitors as such, Doxper, Agnito, Doxper